Yeah, what is the level of free testosterone most men are optimized on?
Oh right, yeah, wow, yeah. That's a big one, isn't it? Essentially that's how long is a piece of string. So you'll get some guys, and it's got to be patient centric, hasn't it? You'll get some guys that are optimized on. I'm going to speak in UK terms here, but you'll get some guys that are optimized on maybe a zero point 0.5 nanomoles per liter free T, and then some guys that need a 1.5. Now, what we need to bear in mind is when we're getting towards those more sort of much higher levels, so sort of 2 to 3 nanomoles per liter plus, you're entering sort of supraphysiological territory. Now, whilst that may make you feel absolutely great for a period of time, chronically over the years, that there is some data to support that does, because we have to remember testosterone is an anabolic hormone. It's responsible for growth of cells. There is some evidence of cardiac remodeling, and the most common form being left ventricular hypertrophy. So if you are one of those guys that requires a little bit of a higher free testosterone level, that's all well and good, as long as your clinician that's managing you is aware of the risk of being at that level and is actively monitoring you and ensuring your safety. But like I said, you won't find many guys that are going to be needing sort of 2 to 3 nanomoles per liter free testosterone. Usually in my clinical experience, sort of anywhere between sort of 0.8 and 1.2 to 1.5 nanomoles per liter, most guys tend to feel pretty good on. Now, if you start getting other sort of side effects like increased erythropoietin production, which can be a side effect of having a free test level that's higher, and that's raising your hematocrit. I mean, this is a can of worms, isn't it? you don't really, for me personally, excuse me, I don't worry too much about hematocrit as a number, because secondary erythrocytosis, secondary to being on TRT, isn't actually is well studied, and it isn't actually a massive risk factor for deleterious cardiovascular outcomes. Now, having said that, like I said before, you've got to think about those guys that have a cardiac history. If they're raising it and their BP skyrocketing despite being on antihypertensives, then yeah, you need to sort of look a bit more closely at that. But as a general rule, if your free T level is high enough to be sort of pushing your hematocrit up, but your hematocrit number is so let's say it's 0.6, for example, but it's causing no clinical issues, like you're not getting raised blood pressure, it's causing no fatigue, you're not getting breathless, then this is well supported in the literature. Secondary erythrocytosis to TRT isn't a risk factor for deleterious cardiovascular outcomes. It's more the fact that high free test level is causing over time, and we're talking years here, like many years, is likely to put you at increased risk of cardiac remodeling. I think we in terms of what number is the best, it's whatever feels good for you as a patient, and that needs to be agreed and monitored between you and your clinician.
Consider becoming a channel member to benefit from several perks. And check out all the things I'm associated with. The Shop Test Store for insulin syringes, alcohol swabs and 10cc glass vials. My ebook, The Ultimate Guide to Testosterone Cream. Mizumi Skincare. Online pharmacy NP Labs. And multiple workout programs that I designed myself.